Hi guys and welcome back. Today I want to share with you an important update on the new CQC framework. This framework is designed to improve healthcare regulations by focusing on patient need, leveraging data and technology, and ensuring a more patient-centric approach. Let's dive into the primary goal and key changes of this new framework. The primary goals of the new CQC framework are threefold. Number one, providing responsiveness to patient needs. So, ensuring that care services are responsive to the needs and preferences of patients. Number two, better use of data and technology. So, leveraging data and technology to enhance the regulation and assessment of care services. And lastly, focusing on a more patient-centric approach. So, prioritizing the patient's experience and involvement in their care. So, what are the key changes to the framework? The CQC framework has been updated to make judgments more structured and consistent by developing 6 categories for the evidence they collect. These categories ensure comprehensive and consistent assessments across different types of services. Here are the 6 categories for evidence collection. Number 1, people's experiences. Collecting and analysing feedback from people using the services, their families, carers and advocates. This includes surveys, interviews and feedback from community groups. Number 2, feedback from staff and leaders. Gathering insights from healthcare staff and leaders through surveys, interviews and focus groups. And number 3, observations of care. Direct observations by CQC inspectors, specialist professional advisors, assessing the care environment and interactions. Number 4, feedback from partners. Collecting evidence from organisations that interact with the service, such as commissioners, local providers and professional regulators. Number 5, processes. Reviewing the steps and activities that providers undertake to deliver safe care, including audit results and safety incident reports. And number 6, outcomes of care. Evaluating the impact of care on individuals, such as mortality rates, infection control rates and patient-reported outcomes. Let's talk about the steps in the new CQC framework. Number 1, understanding the quality statements. The framework is built around quality statements which outline the standard providers must meet. These statements are aligned with regulations and define what good care looks like. Number 2, evidence categories. For each quality statement, the CQC specifies the evidence they will collect, which will vary depending on the type of service and the assessment level. Number 3, assessment process. The CQC will use 6 evidence categories to organise their judgments. This ensures consistent approach across different services. Not all 6 categories may be necessary for every assessment. However, the CQC will indicate which are required for robust judgments. Number 4 is provider guidance. Providers can access detailed guidance on the CQC website, which includes descriptions of each evidence category and the types of evidence required for different services. Number 5 is feedback and improvement. The CQC has shared this framework in draft form to gather feedback from providers and improve the final guidance. And lastly is emphasising learning and improvement. The new framework encourages creating cultures that learn and improve, setting expectations for how services should work together to deliver safe, person-centred care. The evidence collected will vary based on the service type. For example, GP practices will have different evidence requirements compared to home care services. Each quality statement will have associated evidence categories that outline what CQC will look for during inspections. Here are some examples of quality statements and evidence. The first is safe. The I statement is, I am protected from abuse and harm. The we statement, we conduct thorough background checks on all staff, provide regular safeguarding training and implement robust safety protocols to ensure a safe environment for everyone. I statement, I feel secure and supported in my environment. And the we statement is, we maintain rigorous health and safety standards, conduct regular risk assessments and ensure all safety equipment is well checked and easily accessible. The next is effective. So the I statement is, I receive care that meets my needs. And the we statement, we use evidence-based practices, regular reviews and update care plans with service users and ensure continuous professional development for our staff to meet the individual needs effectively. I statement, I receive personalised care that supports my health and well-being. And the we statement, We tailor our care plans to each individual's preferences and needs, collaborate with healthcare professionals to provide comprehensive care, and use technology to monitor and enhance health outcomes. Next up is caring. So the I statement is, I am treated with kindness and respect. And the we statement, we foster a culture of empathy, provide extensive training on respectful and compassionate communication, and celebrate each other's dignity and individuality. I statement, I feel valued and listened to by staff. And the we statement is, we prioritize active listening, encourage open communication, and implement feedback mechanisms to ensure that every individual's voice is heard and respected. Again, we have responsive. So the I statement would be, I get the support I need when I need it. And the we statement, we offer flexible scheduling, promptly respond to requests and feedback, and continuously adapt our services to meet the evolving needs of those we support. I statement, I am supported to live as independently as possible. And the we statement, we provide personalised support plans, promote self-care and independence, and offer resources and assistance to help individuals achieve their personal goals. And last but not least, we have well-led. So the I statement would be, I experience high-quality care from a well-run service. And the we statement, we ensure transparent and accountable leadership, conduct regular quality audits, and engage in ongoing improvement based on feedback from service users, staff, and other stakeholders. I statement, I trust the leadership to provide quality care and support. And the we statement, we uphold the highest standards of governance, foster a culture of continuous improvement, and ensure that our leaders team is visible, approachable, and responsive to the needs of staff and service users. The new CQC framework is designed to enhance the consistency, transparency, and effectiveness of healthcare regulation. By focusing on structured evidence collection and person-centered care, the CQC aims to ensure high standards across healthcare services. Providers should familiarise themselves with the quality statements and evidence categories to align their practices with the new framework. Thank you for watching, and feel free to reach out